So think about this. Thousands of international healthcare workers join the German medical system every single year. I mean, it's a massive, incredibly skilled workforce that is literally keeping world-class hospitals running. If you're a nurse, a carer, or just working in health in Germany, or, planning to make the jump, you already know that communication is the absolute bedrock of what you do. But when that communication happens in an entirely new language, wow, the stakes are suddenly raised exponentially. Today, we're breaking down the absolute essential medical German vocabulary you need to actually thrive. We're going to focus heavily on the core stuff that pops up on every single shift: body parts, vitals, and symptoms. Let's dive in. Okay, I want you to picture this scenario. You're right in the middle of a crazy busy ward. It's late, those fluorescent lights are just glaring, the monitors are constantly beeping away in the background, and your patient looks up at you in clear distress and says, Ich habe Schmerzen. I have pain. It's a super high stakes, urgent moment, right? Immediate action is required. But it's also completely ambiguous. Like, is it chest pain? Is it post-op pain? Where exactly does it hurt?
And there you are, just standing there, nodding. Let that reality land for a second. It's that terrifying, paralyzing awkwardness of the language barrier in a clinical setting. You want to help. You literally have years of extensive medical training to help, but the words are acting as an impassable wall between you and the care your patient desperately needs. Maybe you're frantically running through a mental dictionary, trying to remember if the German word Bein means leg or, wait, does it mean bone? Meanwhile, the clock is ticking.
Which brings us to our first section: patient safety and the true stakes. See, we need to transition away from just talking about that initial discomfort or, the embarrassment, because the true scope of the problem really comes down to a stark comparison: a mildly awkward interaction versus a legitimate threat to patient health. Not knowing basic medical German isn't just one of those embarrassing moments where you smile politely and nod. Actually, a lack of basic medical German could actively cost someone their health. Misinterpreting a symptom just because of a language barrier, that can lead to missed critical interventions, delayed care, or even worse, the wrong medication dosage entirely. The gap between an awkward interaction and a severe medical error is, well, it's simply knowing the right words when seconds count. Moving right along to Section 2, Essential Vocabulary Rapid Fire. So the crucial point here is that we absolutely have to bridge that language gap, and we need to do it super efficiently. Let's run a quick rapid-fire drill to show you just how quickly you can absorb this vital info. Okay, ready? The lung becomes die Lunge. Blood pressure is der Blutdruck. The artery translates to die Arterie. And blood sugar? That's der Blutzucker. Notice how direct that is? We're talking about the heavy hitters here. This is the stuff that comes up on the ward every single shift without fail. Literally, in just a few seconds, you're already building the foundation you need. 80. Just think about that number for a second. I want you to imagine the empowering multiplier effect of what we just did. We knocked out a handful of terms in just a few seconds, right? Now imagine having 80 of these essential, foundational terms just flowing fluently from your memory. It completely transforms your shift. Just picture the absolute confidence of walking into any patient's room, instantly understanding their vitals, recognizing their reported symptoms, and knowing exactly which body parts they're referring to without a single moment of hesitation. A total game changer.
All right, Section 3, Conquering the Talc Plague.
That confidence we were just talking about, it isn't just for a single shift. It actually logically maps out your entire professional journey in 3 clear steps. Step 1 is exactly where you are right now. You master this essential vocabulary: the body parts, the vitals, the symptoms. Then Step 2 takes that foundational knowledge and uses it as your main tool to absolutely crush the Talgfliege exam. And look, that exam isn't just a piece of paper. It's proof that you can safely integrate into the system. And finally, Step 3. You unlock your ability to work confidently, safely, and effectively as a healthcare professional in a German-speaking hospital. Every single step perfectly, naturally supports the next one. So I want to leave you with this thought. When that patient looks at you in sheer distress and says they're in pain, are you going to just nod next time? Or will you know exactly what to do? Make sure you are never caught off guard on the ward again. Thank you so much for hanging out with me in this explainer. Now go out there, grab a pen, and start building that vocabulary.